Hey everyone, this is Group 7. This awesome group of ours consists of three gentlemen, including myself, Stephen, and David. We as a group give Dr. Deer the consent to show this video to other classes. The title of our research is EMG Biofeedback Analysis, comparing the activation of erector spinae at different knee flexion angles at L3 in healthy college students. Stephen is going to talk to you guys about the methods and the subjects, and David at the end is going to talk to you guys about the strengths, weaknesses, opportunities, and threats.
Thank you, Subin. I'm Steven. I'm going to be speaking to you about the subjects and methods of our research study. We did a convenient sample in order to collect our subjects, we wanted 30 subjects, which we achieved. They either had to be male or female, ranged between the ages of 18 and 24, and be a Dominican college student. For our exclusion criteria, they could not have any history of neurological, respiratory, spinal, trunk, or lower extremity musculoskeletal pathologies or any lower back pain within the past 30 days from our study. Now moving on to the methods. So the patient would come in, fill out informed consent. We then would set up the Delcy-Bagnoli EMG biofeedback system, and then we would then place a reference node upon their shoulder, followed by two recording nodes on their lower back at the L3 erector spinae. We then would demonstrate to the subjects the 4 moves that they had to do. So one was a full back extension for max voluntary contraction, followed by the 3 bridging exercises with their knee angles at 30, 60, and 90. So after we demonstrated that, we then would have the subject lay on the mat. They would then do the full voluntary contraction for 5 seconds with a 10-second rest. Then they would turn over, go into the bridging form at 30 degrees. They would do another 5-second hold. The data would be recorded for the max voluntary contraction at the erector spinae. Then they would get another 10-second rest. We would set their knee angles to 60 using the goniometer. And then they would do another 5-second contraction. Then another 10-second rest, set their knee angle to 90 with the goniometer, do another 5-second contraction, and then all that data was recorded. Then after that, we would remove the electrodes and the patient would be asked to leave. Now I'm going to pass this over to Dave.
Hi, so as you know, we did our research on EMG biofeedback, and I'm just going to talk to you about some strengths, weaknesses, threats, and opportunities. So some strengths, we thought that time management was one of our strengths. We came into this project knowing that we would be in clinicals and class simultaneously, and I thought we did a really good job at meeting once a week, learning how to use a software, touching base with each other, and just making sure everyone's up to speed. Weakness, I guess it's not really a weakness, but we were a little naive going into this project. We had to meet 4 or 5 times with the techie people to actually understand how to use the EMG software, and this took out of the time that was supposed to be spent towards data collection. So now we know how to use the system for our purposes. We know how to set the parameters to achieve what we're trying to do. But outside of our comfort zone, the software can really be a nightmare. Opportunities, this whole process has given us opportunity to learn how to interpret data, critically analyze data. It's allowed us the opportunity to use a highly relevant tool in physical therapy, that being EMG biofeedback, and we look forward to the parametric testing and the whole data analysis process in the near future. Then we have threats. I think the only threat to our research is that we only use 30 subjects. We thought that 30 subjects was an ambitious goal, and it actually proved to be really difficult to acquire this many subjects, especially since we were in class and clinicals, and it took us a while to actually learn how to use the system. But with lack of subjects, it really increases the likelihood of type 2 errors. or false negatives, and we hope that all the measures we took up into this point decreases that likelihood, and that everything goes smoothly for us. That's it. Thank you.